One of the main hormones that sustain the bones is these female hormones, also in males, male hormones. We have injectables of several types, some of them which need to be taken every day, some of them which can be taken once in a year, some of them which can be taken once in 6 months, so on and so forth. Hi, എൻ്റെ പേര് ഡോക്ടർ ടോം ബാബു. ഞാൻ എറണാകുളം Silverline Hospital consultant endocrinologist and medical director ആണ്. So today we are going to talk about a unique disease called osteoporosis. I'm sure a lot of you are not aware of this disease, but you may have seen it, you may have heard about it in another manner. Now, what exactly is osteoporosis? Osteoporosis is, to put it simply, it is a state where our bones become very brittle, soft and very fragile. So what we must understand is that it is the elderly population who's at risk, primarily at risk for the disease. We'll come to that in a bit. Why is it important to understand this? Because if you look around you, in our own societies, in India, you can see that our population is pushing beyond 65 now. Bulk of our population is pushing beyond 65. Of course, we have a young population between 30 to 35. We have a big chunk of our population in that age group. But we also have a big population who are pushing beyond 65. Now, if you look at the Western countries, you can see that they already have a large population living beyond 65, 70. So we've already started to see the perils of that age group or the unique problems that come with that age group, which is one of the biggest problems is osteoporosis. Why are we scared about osteoporosis? Because if I were to put it very simply, it is that when the bones become brittle, the tendency to fall and break a bone is very, very high. And if I were to say, when somebody falls and breaks a bone or has a fracture, at that age, you lose the plot. Meaning that you get bedbound, and that is recipe for disaster. Because there is a good chance that somebody can die very quickly after they get bedbound. So that is what we want to prevent, and we want our population to live longer, beyond 80 and beyond. So therefore, first let us see who is at risk for this disease. One, elderly women. Now when I say elderly, it can start from 50, right? So we need to start watching out from 50. But it is at 65 and beyond, clearly the women are at risk. But not to mention that males are not at risk completely. They are also at risk, but maybe a little bit later, at 70 and beyond. So women, why is women particularly more at risk than men? Because when women enter menopause at 50 years of age, their female hormones start to ebb, start to go low. So one of the main hormones that sustain the bones is these female hormones, also in males, male hormones. So when that hormone starts to go low, the bones start becoming brittle and there is a chance for fractures. So, and let's take these women particularly, because like I said, they are the ones who seem to take a hit most. So if they, on top of the fact that they are aging, if they had an early menopause, so we know that our women, some of them, have menopause at the age of 40 or even before sometimes. These women are at particular risk for osteoporosis. So this is something that one must bear in mind. Second, if this male, elderly male or female has had a family history of fracture. That is something that will tell them apart, because if there is a history, then they are at risk. Then another big giveaway for this disease is that has there been a fracture before? Have they had a very unsuspecting fracture, meaning that suppose they was sitting, or a fall from a standing height, not from a very not from a the fall has been a very trivial fall, not from a great height, but a simple fall. And if somebody has fractured, then that becomes a risk factor. So these people also should watch out for fractures henceforth. The other thing is that, have they had taken steroids for rheumatoid arthritis or other autoimmune conditions which require steroids for over a period of time? And when I say over a period of time, even if they've had taken steroids for more than 1 or 2 months in a row, they are at risk also. So we need to screen these individuals also. And women who have been consuming alcohol, of course in our societies women don't consume that much of alcohol, but in Western societies they do, so that is a risk factor. But males, certainly if they are smokers, if they have been consuming a lot of alcohol, these individuals are also at risk. And if for example these women have had malnutrition of some form, say for example there are a lot of diseases that cause malabsorption, so these women are very lean, they are very emaciated, so these women are at risk also. And generally lean individuals are at risk. So why are these lean individuals at risk? Because when they fall, they tend to hit the bone directly. There is no pad of fat which will cushion their fall. So therefore, they can shatter the bones when they fracture. So lean individuals are the ones who need to watch out for since they are at risk for fractures. So now, what are the symptoms of osteoporosis? So actually, till you break a bone, there may not be any symptoms. Now that is the difficult part about diagnosing osteoporosis, or to find out the symptoms. There may not be many. So one would be that if sometimes they have aches and pains. Yes, that is one of the symptoms that they can manifest. Why the aches and pains? Because they can have small vertebral fractures. They can fracture their vertebra, and therefore can produce nerve let's say a root pain that can manifest as a low backache, or generalized aches and pains also, because one of the key reasons for osteoporosis is low vitamin D. So low vitamin D can manifest as aches and pains, and therefore this can be a tip off that the individual could be osteoporotic. Then, like I said, in the past, if there has been any suspicion of a trivial fracture, this can be one of the symptoms. It is something that gives a tip off, but it can also be a sign of things to come. So that's something that I would group as a symptom. So let's see how osteoporosis manifests, or in other words, the symptoms of osteoporosis. So the most important symptom is that when women start noticing that they are losing height, or they are growing shorter. So this is something that their husbands may point it out to them. They may notice themselves, or somebody around them point it out to them. And that is when they take notice of this. And secondly, it becomes a disfiguring disease, because they start stooping forward. You can see a hump that these people slowly develop. It's mostly seen in women, but sometimes you can see this in men as well. So they start stooping, and you must have seen these pictures where you will see this elderly women bent over on a walking stick. So they start bending over so much so that their ribs can touch their pelvic bone. So that is how much that they can bend over. And this is why it is very disfiguring as well, not a pleasant sight of an elderly person stooping over this much. So that is one predominant symptom how they manifest. And second, they fracture very easily. Even something that we cannot comprehend, even something as little as a sneeze can produce a vertebral fracture, or a simple knock over an object which otherwise you would never imagine can produce a fracture in an osteoporotic person. Then it can also manifest as aches and pains, because as I told you, one of the common causes for osteoporosis, on top of the fact that it is seen in menopausal women, etc., I told you that plus vitamin D deficiency is a common cause for osteoporotic fractures. And vitamin D, so the unique thing about vitamin D deficiency is it can present with aches and pains, and we have a separate term for that called osteomalacia. But all that it says is that because of vitamin D deficiency, the bones not only get brittle but get soft, and as a result of that it can present as bony pains. So the pain also is a tip off, or can be taken as an important symptom or sign of osteoporosis. Now moving on, let us see how, because this is a silent disease mostly, so you need to diagnose this. So the diagnosis will be mostly by screening these people who are at risk. So that is unlike other diseases which will announce itself dramatically. Osteoporosis will be picked up by screening, and therefore you can, by picking up those people, you can prevent fractures. So this is what this is all about. So how we screen is, we pick up women over 65 years of age, or sometimes even prior to that if they have other risk factors, and males over 70 years, and we look for some of these look to see if their bones are healthy. And one of the key tests that we do is called Dexa. Dexa is a simple X-ray which we use, and unlike the normal X-rays where we have our patients standing, this X-ray is taken with them lying down. And the beauty of the Dexa is that the radiation exposure is only a percentage of what radiation exposure a patient is subjected to when they go for a chest X-ray or a CT scan. So therefore it's a very safe procedure, very simple procedure, but it gives us a lot of information about the bone quality. And depending on the Dexa scan, we then decide on the type of treatment. The treatment can be simple. Sometimes we even just replace vitamin D. It's an oral tablet, and once the vitamin D levels come up, their osteoporosis may just go, or the quality of bones may just improve. Then if that doesn't work, or sometimes we need to intervene more aggressively, so then we can give them tablets, which sometimes can be given once weekly, or we have injectables of several types, some of them which need to be taken every day, some of them which can be taken once in a year, some of them which can be taken once in 6 months, so on and so forth. So the important thing here is that you identify the disease early so that you can treat it effectively, and thereby ensuring that our people can live longer, healthier and meaningful lives. Please share this video to as many number of people as possible so that they can all learn about this disease. Thank you.